just for the
please do.
intro slide.
So I think I can see people joining. So I will welcome you all to our latest community conversation. And we're going to be talking today about the Asia-Pacific experience in developing a minimum training package on anticipatory action. We have some speakers from FAO to join us today. So that's Damien and In-Young. They're going to be taking you through the discussion and the presentation. And just so everyone in the room is aware, we are recording this. So if you'd rather not be shown on the screen when we put it on our YouTube channel later, please just keep your video off and we can still take your questions in the chat. So yeah, if you'd rather not be seen, that's the best way to do it. So thank you for joining us, and I'll hand over to In-Young and Damien.
Thanks a lot, Tim. So I cannot see who's there, but I hope that participants are slowly joining the community conversation. So what we really wanted to share is indeed the experience of the Asia-Pacific Anticipatory Action Technical Working Group on developing a minimum training package on anticipatory action. I'm Damien. I'm working with the regional office of FAO based in Bangkok, covering Asia and the Pacific. And I'm supported by In-Young. If you would like to introduce yourself.
Sure. Hi, everyone. My name is In-Young Jang. I'm an AA specialist with also FAO Regional Office for Asia and the Pacific, but we're actually here rather as members of Asia Pacific Technical Working Group on Anticipatory Action rather than wearing FAO hats. So I'm really glad to be sharing this experience, and thanks so much for joining.
And hopefully Raphael is there?
Yes, I am here.
Raphael, you will be our last speaker. So if you would like to introduce yourself.
Sure, thanks, Damien. Hello, everyone. I am Rafael Diaz, delegate from the German Red Cross working in Myanmar on anticipation and supporting the Myanmar Red Cross Society on that topic specifically. Welcome, everyone.
Thank you, Raphael. So just quickly, this is a 15 slides presentation that hopefully will give you background on the process for developing the minimum training package on anticipatory action. We will also take you through the content rapidly, and Raphael will be able to share some learnings from the actual translation of the training at country level. So there will be 3 kind of mini sessions, and we will use a bit of Mentimeter to interact with you participants. So get ready. There will be 2 times a series of 3 questions on Mentimeter to hear a bit from you, and hopefully we can keep the time at the end of the presentation to discuss with you, answer questions, get your feedback on what we are going to present. So without further ado, I will give the floor to In-Young to present the first slides. Over to you, In-Young.
Thank you, Damien. Can you move to the next slide, please? Great. So before we start, I'd like to give a bit of a context of AA, the anticipatory action landscape in the Asia-Pacific region, and sort of introduce to you why this package really mattered to us. The Asia-Pacific Anticipatory Action Technical Working Group has conducted mapping exercise since last year to really take stock of anticipatory action systems as really the space is growing. And we're observing that many countries have been involved in developing AA systems and also implementing them. And according to the 2024 mapping, 91 respondents reported 137 AA systems across 15 countries. And as seen in the map, you can see that the Philippines, Bangladesh, Nepal had the most systems. And we're also observing more new entrants being introduced to this approach this year. This is not shown in the map, but Papua New Guinea and Fiji as well. And there are also increase in the number of systems in certain countries like Indonesia and Afghanistan as well, which is very interesting that we're seeing. So as the anticipatory action space is growing in this region, there are also challenges that arise, such as lack of coordination, and policy, institutionalization, etc. And this lack of coordination also applies to training and capacity building among partners and stakeholders as well. So back in 2022, at the regional dialogue platform in Bangkok, AA practitioners in the region identified the development of a minimum training package on anticipatory action as our priority needs and activity to address these challenges. At the country level, the messages around anticipatory action in the training delivered to the stakeholders by different partners are sometimes inconsistent. And they may use different terminologies like forecast-based financing action or early warning, early action, anticipatory action, what have you, while targeting sometimes the same audience. So this really causes sometimes confusion among stakeholders and hindering that institutionalization and scale up of the approach in the country. It's important to note that this work of developing the training package is not done from scratch, but really building on the technical working group's work on building the consensus around the approach and harmonizing the terminology, the technical standards through the development of this document. So to sum up, the main objective was really aligning that messages on anticipatory action being delivered by AA actors to stakeholders at the country level and also at the regional level or sub-regional level when they're organizing the training, through really collectively contextualizing the training to their own country context in a coordinated manner and while utilizing this minimum training package. Next slide, please. So this is sort of an overview of how we develop the training package step-by-step process. It's very simplified, but it started with creating the training subgroup January 2023, last year. It was initially joined by interest agencies who are member of the Asia Pacific Technical Working Group, FAO, OCHA, WFP, American Red Cross, World Vision, and CARE. And you can see the diversity of the agencies involved, which are reflecting really who's implementing in the region. And later, more agencies like Action Against Hunger, UNICEF, and SART Network also joined. So this was really a collective effort that really was driving this development and ultimately created that collective training package. We started by reviewing existing materials, so not starting from scratch, but looking at what's already out there in the region, but also global materials too. So we assessed the commonalities of messages in existing materials, but also identified what's missing in the training materials, right? And look at areas for improvement, what do we agree on as our core group in this subgroup, and also identified gaps in case studies in the region as well. The next step was incorporating now the learnings from in-country experiences, not only in terms of the training contents, but also like how the training was delivered at the country level too. For instance, in Bangladesh, to develop that the harmonized anticipatory action framework at the national level, they had delivered the multi-agency training. So as a subgroup, we wanted to learn from them as well, how they organized the training, how did they harmonize the messages, how it was received by stakeholders, which they targeted, and we incorporated those learnings to this package and thought about how we would facilitate that session and also share those learnings to other countries as well. There are also other examples from Sri Lanka, which they delivered national training by World Vision, Red Cross, etc. So we learned from them like what kind of training contents they delivered to national stakeholders and what was understood by stakeholders and what was missing. What can we complement with our regional training package? So this was really important segment of this development process. And also we had later I'll explain, but pilot trainings at the country level as well, where we tested our training package with certain number of countries. So then we can see also how this was received by stakeholders on the ground too. The last step was, reviewing, of course, the content by broader regional ATWG, making sure that we incorporate their feedback and making it as TWG product rather than, like certain agency efforts, etc. And then also gathering those important inputs, such as like case studies from different countries. We often observe that there are only case studies from certain countries like Bangladesh, Philippines, which makes sense because they have anticipatory action systems for longer years. But we try to make sure the diversity of that and adding more additional materials and perspective. To give you an overview of the minimum training package, what it consists of, we will go into details by Damien, but basically we have 9 modules in total, but it consists of 4 foundational modules going through concepts and the step-by-step process of AAP development, the trigger, the financing, basically the 3 building blocks of anticipatory action. And then for more advanced modules that countries can go into details about anticipatory action more operationally and testing the approach and how do we gather the evidence and how do we, ensure institutionalization and policy advocacy, etc. So those are more advanced modules that country can opt for. And then the next, which was, we worked with the Red Cross Climate Center and German Red Cross on the use of social protection in anticipatory action. This is considered optional because some countries, may wish to cover that topic, and some countries may not be there yet. So when we developed the package, it was also important to test them and think about how we are going to launch the product so that it can be disseminated effectively. And around January this year, this was when we had the almost the first draft set of package and decided to launch our product through training of trainers at the regional level. So inviting different countries to Bangkok and then, presenting the materials and also look at how this can be used at the country level. By February, we identified 3 countries to pilot test the training package with the country core groups. So the national technical working groups at the country level. We had Indonesia, Philippines, and Solomon Islands who showed interest to test our training packages. The initial idea of selecting these countries was that we had, the new entrants, newcomer level, and then the intermediate level, and then the advanced level countries that have, been involved in anticipatory action. So Philippines obviously were more advanced level. They have more experience than Indonesia and Solomon as a newcomer to anticipatory action. And then around this time, we started begin to be in touch with national technical working groups to tell them about, the training of trainers, and we identified 12 countries in Asia based on our mapping exercise as well that are involved in anticipatory action to join the training of trainers and identifying the core actors that can disseminate the training materials at the country level and active in anticipatory action. And so around March, it was when the pilot trainings were tested in 3 countries, and we made sure to debrief with them and learn what worked and what didn't work through the pilot training, and had the time to really prepare for the TOT and revise any points that needed to be revised based on the feedback. And we had the help of independent consultant, Zoe Scott, who helped us sort of formulating the training TOT materials and adjusting some parts to the TOT context as well, and draft the facilitation guide too. And April 23rd to 25th was when we had the regional TOT, attended by 36 participants from 12 countries that were selected by National Technical Working Group on Anticipatory Action. We had a set of criteria for the attendees, such as, if they had the training experience, if they were active in AA in their respective countries, and if they have the plan to deliver a training within the year. There was sort of our priority criteria to select the participants, and they were selected by the National Coordination Group. So it was really effective in sharing the materials as well. And then we had 8 facilitators from the Regional Technical Working Group from different organizations as well, to ensure a collective delivery of our training materials to these country participants. And as mentioned, we had an independent consultant that helped pull together the preparation as well as revision of these training materials to fit that TOT needs. Then based on the feedback that we gathered from regional training of trainers, which was really well appreciated by our partners in Asia, we were able to refine and design the module to launch them eventually on Anticipation Hub.
And I think in Young, this is where we stop for a little while the presentation. We would love to hear some feedback from you on the minimum training package. So if you would be able to open Mentimeter, I will share the screen. Sorry. Give me 5 seconds. I will quickly switch to Mentimeter. That's the one. That will be the first question. So we would like to know what AA training material you are usually using for your activities, just to see if we have the same kind of reference. So I see Red Cross material indeed, OCHA. We also looked at it when we studied the process. FAO, glad to hear that I'm assuming the online FAO training material is easily accessed. I think in Young, those are the 3 main training material we use, right?
And I can see that these materials are agency-based as well, and may not meet that needs of coordinated training to different stakeholders by different partners.
A range of different ones. I see the beat, the hazard game. All right, maybe we can see that more or less we are all using the same references when developing a training package. Maybe we move to the next question. Sorry. Up. So we would like to know. Yes, please.
Sorry.
Go ahead.
This question is about who should be involved for delivering the AA training or developing the AA training, which stakeholder, which partner, which actor should be involved.
And if you answer a mix of agencies to prepare and deliver the training, that's exactly what we try to promote in the region. Practitioners, yes, certainly. That's interesting, involving national and subnational government in delivering the training. That's certainly something that can be done at country level, but we need to work with them and capacitate, give them some capacity building. Academician, yes, definitely. That is something we have also been considering in the region. Technical partners for the trigger, that's certainly one of the most challenging training module to deliver and requires a bit of technical knowledge for sure. Excellent. Maybe I move quickly to the last question, but keep your Mentimeter open. We will have 3 more questions later on. Ignan?
The next question is, what challenges related to anticipatory action are you facing in your region or your country, or do you foresee? Contextualization, yes, for sure.
So the funding for fuel is maybe a challenge for AA implementation. As for the training itself, yeah, we do explain the difference between the fuel and build funding, but as part of the training, it's quite easy to explain the differences. Not comprehensive and contextualization again. Too many ideas, which can be sometimes, a limitation indeed. Lack of consensus. Exactly. Great. So I think it's very, very valid and obviously when we started to work on the minimum training package, it was because we wanted to come up with a more consistent and consensual training package that can be, used by different agencies and carry the same important messages to partners. So I'll stop here for now, the Mentimeter, and we'll go back to the presentation, but keep the Mentimeter open. We'll get back to it in an instant. So quickly back to the presentation. As Ignan was mentioning, immediately after the regional training of trainer, which has been extremely well appreciated by partners, I wanted to stress that in the last South Asia dialogue platform, a number of countries were saying that the regional training of trainer was one of the key milestones in their respective anticipatory action journey. And I was quite happy to hear Pakistan or Sri Lanka mentioning that the regional training of trainer on the minimum training package was a essential milestone in building the anticipatory action capacities for their respective countries. So immediately after the regional training of trainers, which happened last April, we got the feedback from participants and the feedback from the 8 facilitators from 7 different agencies and finalized the training package. It is uploaded on the Anticipation Hub Asia Pacific webpage. I trust we can share with you the link, but it's quite easily accessible on the Anticipation Hub webpage for Asia and the Pacific. We did mention we have 9 training modules for now, and I will explain a little bit more about what is covered by the respective modules. Ignan already mentioned we have 4 foundational modules, and those 4 modules are really the core of the minimum training package. It has been used systematically by all the countries who implemented a national country training. So those are really the essential modules, which are systematically used in a training at country level. The first module 1, is presenting the AA concept and AA building blocks. Pretty straightforward. It explained the trigger, the set of anticipatory action, the financing, like explaining how anticipatory action is sitting in the disaster management framework. We had some feedback from a number of countries that we need to create a bit more explanation on the connection between preparedness and anticipatory action, and the connection between anticipatory action and response. That's something we will be working on in the future, but we have a few slides explaining where anticipatory action is sitting. And we also explain how anticipatory action is differing from a traditional response. The module number 2 is really highlighting the importance of developing an anticipatory action protocol, which sometimes can be called early action protocol. In the Red Cross, government might call it standard operating procedures. But what we are really asking for is to have a document that is explaining the key element of anticipatory action, the trigger, the set of anticipatory action, and the budget that would be required for its implementation. We have been hearing certain countries about the implementation of anticipatory action without written AA protocol. So indeed, this is something we highlight in the module 2. There is a possibility to do anticipatory action without a pre-approved document. Nonetheless, if we want to promote harmonized and joint activation of anticipatory action, we think it is extremely important that something is written and shared so that different partners would agree on certain procedures and try to use harmonized trigger methods and coordinated set of anticipatory action when a severe event is being predicted. So the module 2 is highlighting the step-by-step process to develop the protocol, from historical impact review up to the simulation exercise that is very much a key step before finalizing a protocol, and gives an explanation on how to develop those protocols. We also talk about the use of theory of change as something that we want to promote as much as possible across the countries, across the agencies. The module number 3, and I will try to go a little bit faster. The module number 3 is all about triggers. We did mention in the Metimeter that this one very often requires some technical expertise and can be delivered with maybe the national Met office in the different countries. It explains how to come up with those clear trigger points. We talk about the use of multi-threshold triggers, for instance, for flood. We are explaining, and that's becoming extremely important, the difference between early warning and anticipatory action trigger, because sometimes the early warning for all initiative might confuse government partners. And we are explaining how these different trigger elements, risk assessment, forecast review, and definition of trigger points, either based on a hazard magnitude or an impact forecast, can be developed. Then we have a module 4 on AA financing, and as it has been mentioned in the Metimeter, this module is looking at the different financing that are needed, the financing to build the anticipatory action system, and the financing that is needed for fueling the anticipatory action system. What we've seen, and I will not explain too much in detail, but what we've seen is that a lot of actors, when they develop their training package at national level, try to merge this module 4 with institutionalization, so that somehow the financing is the entry point to talk about certain legal aspect for accessing funding for anticipatory action, and try to explain to government what could be for them the source of financing for their own anticipatory action in future. Something that we are really pushing in the Asia Pacific region. So this module on AA financing is, we've seen in the past months, very often merged with the module on institutionalization. Those advanced modules, what we've seen is that they have been used in those countries which are perhaps a little bit more advanced, like Bangladesh, Philippines, or Nepal. Unfortunately, not all countries have been working on anticipatory action as much as those 3 advanced countries. And it is sometimes difficult for a country like Myanmar, and Raphael, I hope you will contradict me if I say something wrong, but for a country like Myanmar, it is extremely sensitive to talk about institutionalizing anticipatory action. So those advanced module 5 to 8 can be used or not by the countries. And we saw that some countries have used the module 5 on simulation exercise, so that they can organize a simulation during their training. There is a guidance on how to organize a simulation and test the preparedness, readiness, and activation phases. We have heard also that the module 6 on operationalization of anticipatory action is very, very well received by national partners. In this particular module, we try really to contextualize what it means to activate. What are the challenges faced, especially for rapid onset events? When we have 72 hours to implement typhoon anticipatory action, what are the key barriers and challenges we might have to anticipate? Can we use preposition stocks for doing quick intervention? How do we do cash if the activation happens on a Saturday or Friday and the banks are closed over the weekend? What happens if we are activating in vain? So those elements are very much covered by the module 6 on the operationalization of anticipatory action. Module 7, the monitoring and evaluation. Of course, we are advocating for common production of key evidence around anticipatory action. Hence, the need for every agency to pre-plan the collection of information post-activation. So we have a module presenting the different procedure that can be considered for collecting information post-activation, as a through focus group discussion, post-distribution monitoring, after action reviews. We explain what has been already collected in Asia and the Pacific. We highlight certain of the gaps that we are seeing, and there is still very, very significant gaps in the evidence base for anticipatory action. Unfortunately, we really need to work on this, and that requires everyone support. Finally, the module 8, I did mention that it is sometimes difficult to talk about AA institutionalization, and this is something that has been merged with the module 4. But yeah, there are some examples of how to present the pathway for institutionalization. And we do advocate for creating a technical working group on anticipatory action as a starting point, to help mapping who's doing what and where, to understand how to coordinate, to clarify how the government can perhaps support this anticipatory assistance delivery. Sometimes it might require some logistic support, and eventually maybe some financing. But we have seen recently in the mapping exercise in Asia and the Pacific that the main priority is for government to be part of the trigger system, to be part of the trigger methodology, and to support the coordination in developing the national anticipatory action framework. Very quickly, I think I have 3 more minutes. We have and In-Young mentioned it already, one optional module that was prepared with the Red Cross Climate Center and the German Red Cross on on the possible use of social protection systems for anticipatory action. We have countries in Asia and the Pacific that have indeed quite strong social protection systems that were able to respond to the COVID crisis, especially in Cambodia or in the Philippines. So there was an interest to develop a module on the use of social protection for anticipatory action. There was, however, not so many countries using this optional module when they developed national wide training package. So we are starting to think about what could be done, what could we add, and obviously we already heard about maybe a module on cash in anticipation. Perhaps something that came also very, very strongly in the past months, the need to explain how to integrate anticipatory action in community-based disaster management practices, something we are going to prepare with the Asian Disaster Preparedness Center in coming months. And I'll finish here with the facilitator's guide overview. If you go to the Anticipation Hub webpage, Anticipation Hub Asia Pacific webpage, you will be able to download the 9 training modules, as well as the facilitator's guide, which explain how to contextualize the different modules, how to prepare the national training. There are on the Asia Pacific webpage of the Anticipation Hub some forms that you can also adapt, such as the pre-training needs assessment or the post-training evaluation. We hope the facilitator's guide is comprehensive enough and explain what is currently included in the 9 modules. This is some document that we would like to update in future, and we are always looking for feedback. So there is a clear feedback process on the use of the minimum training package on anticipatory action in the facilitator's guide. And I think this is where we would want to continue the Mentimeter. I will quickly move back to the Mentimeter question. I hope you haven't closed it. That will be the next question. Do you think this minimum training package could be replicated in your region? Are we selling it well? Is it something that maybe is not of interest? Or maybe you need to discuss that a bit further. I see 3 yes, perhaps. Good. Right now, it's a bit more yes than perhaps, and there is nobody against the idea of developing a minimum training package. Excellent. So it seems more yes. Thanks for that. The next question: would you perhaps develop the training package differently, content-wise? So very, very sorry. We presented the content quite rapidly, so that doesn't give you a lot of time to absorb. But we have covered already quite a lot with the training package. Did you feel that there was anything missing, or would you consider maybe like a different way of organizing it? Good point. So yes, the package is focusing on Asia Pacific, and as In-Young mentioned it already, very much focusing on Bangladesh and the Philippines because I think a lot of feedback and learning already came from those two countries. I don't know, Inyong, if you want to add anything, maybe on the swim point.
No, yeah, definitely. We try to make the package Asia Pacific focus as much as possible so that it makes sense for our region as well. And I should also mention that this package was also contextualized in Pacific sub-regional context too. So it very much highlights the need for contextualization as well, to make that, make more sense for the country level or sub-regional stakeholders.
But yeah, if you want to have a look to the training package, it will require contextualization for sure, because it is adapted to the Asia Pacific region. I might ask, what is CDRFI? Sorry, I'm not familiar with that acronym. Community Disaster Risk Financing? Or
I think it means climate and disaster risk financing instruments.
Climate financing, right. I think it's covered in the module 4 partly, and we think that the climate financing instruments can be very, very appropriate for the system building. And yeah, we have not so much example in Asia Pacific region, aside, I think, in Young, the example of
Pacific,
GCF
yeah,
in
well.
Timor, right? And Pacific. So yeah, we have, I think, a few slides in module 4 on climate financing instruments for building anticipatory action system. All right, perhaps the last question, and we hope we will be able to maybe discuss some of those points at the end of the presentation. Is there like still something that doesn't make too much sense in the minimum training package? I mean, if you want to hear more about our experience with the social protection, very clear, excellent. Maybe I stop here. So it's very clear. And anyway, we will hopefully have 10 minutes, 15 minutes, even more if people want to stay at the end of the presentation to answer questions if there are more questions, more points that seem still a bit unclear. All right, so maybe I'll stop here sharing the Mentimeter and Raphael. I will give you the floor and I will open again the last slides. Over to you, Raphael.
Thanks a lot, Damien. Thanks a lot, Inyong. So we will continue with the presentation. After the standard package was designed and the Bangkok TOT was delivered, the people came back to the respective countries and they started to develop and contextualize their own training packages. So the first one to deliver the first training was Vietnam. They developed a 5-day training, and it was done by FAO, Plan International, and the Vietnam Disaster Management Agency. Then Timor-Leste followed, also a 5 days by FAO Red Cross. Sri Lanka, they did 2 trainings by FAO, WFP, and Red Cross and ADPC. Pakistan, Laos, Myanmar developed a 2-day training. In Myanmar, we had 2 trainings by the Red Cross, MRCS, German Red Cross was supporting as well, plus OCHA Myanmar and World Vision Myanmar. And Bangladesh also end of September. And the last training is expected to be in Cambodia, which is still under preparation. Maybe we can go to the next slide. Thank you. How is the package contextualized in each context, in each country? So we have 4 main steps, and in total it takes around a couple of months or 2 months and a half. The first step is training core and group formation. Here we need to ask ourselves who should be involved in the facilitation, in the delivering of the training, who is rolling out the training on anticipation DRM in the country already. In the case of Myanmar, it was pretty clear that people that had been attending the TOT in Bangkok were the ones that were in charge of delivering, of contextualizing and afterwards delivering the training in Myanmar. And the second step would be to identify the training objectives and the target audience. So this takes around 2 weeks. Why do we need a training in the country, and who should be trained? Those are the two main questions we need to ask ourselves. The first one, in the case of Myanmar, it was pretty clear. There was, since very few years before, a strong interest, a growing interest in the anticipation concept. And at the same time, there was not much going on in the country. And therefore, it was clear that, anticipation needed to be like a training in anticipation was needed. And who should be trained in the country? Well, luckily in 2023, the Anticipation Technical Working Group was established in Myanmar, and those organizations being part of the TIPWG were the ones attending the first training. Then we move on to the third step, which is assessing the training needs and target audience, which takes also around 2 weeks. And basically here, we need to know what is the baseline of knowledge of the interested audience in our country, right? And also we need to know what are the, let's say, the learning objectives, the learning appetite. So therefore, we can do pre-training needs assessments at the country level to help you understand those concepts. And then we have we move to the fourth step, which is the lengthiest one, because here we will basically adjust, modify the training curriculum to fit the needs. And of course, we need to go module by module and changing things here, cutting here, expanding other concepts, etc. So it's more lengthy. For that, we need to know the case studies in the context and include them as examples. And we need to know if there is any available training material in country that needs to be considered. Of course, we don't want to be duplicating things. How can the training curriculum be adjusted to fit the needs? This is also something that we need to consider carefully. And translation is a key aspect here, because we, in the end, need to translate all the concepts to the local language. And yes, maybe in other contexts, this is a bit easier in the sense that, for example, in Americas, maybe going with a single language like Spanish, Portuguese, French can cover different countries, but in Asia, it gets more complicated. And of course, integration of cross-cutting thematic areas. I will explain in the next slide more in detail the fourth step. That is divided into 2 sub-steps, we could say. The first, adjusting the agenda based on the needs, and the second, adjusting the material based on the context. You can hear me well, right? Okay.
Yes, yes.
Thank you. So in the first sub-step, we, as Damien explained, have the 9 modules, and therefore we need to, based on our pre-assessments, based on our discussions at the country level, within the core group, within the technical working group as well, we need to select which modules are more relevant. So most of the countries actually were using the module 1 to the 6, which is basically the foundational modules, plus 2 of the more advanced modules. And as Damien explained, some elements of the module 8 frequently were integrated into the module 4 of financing. Once we have done this, we have to adjust the material based on the context. And here I give some examples. In the module 3 on trigger development, you can add examples of available triggers, existing triggers you have in country. In the module 6, you can also add any operational considerations that are specific to your context. If there has been activations of different protocols in your context, or failed activations, success stories, challenges, etc. All these things are interesting to be included in the modules. Also, countries added additional modules based on their needs, right? For example, some countries added gender equality, social inclusion, and protection related modules, and others, as Demian explained, also added CBDRM related information. Once we are in the process of modifying, contextualizing our modules, we sometimes need to simplify certain informations depending on the audience. This is important to consider. We can go to the next, please. And this is the experience that we have in Myanmar, contextualizing the package. First, we selected 5 main blocks, okay? And this was like the building blocks, the protocol design, trigger development, simulation, and operationalization. And also we integrated some elements of module 4, the module on financing, into the module 2, because we don't have that advanced level of knowledge on anticipation in Myanmar. The team decided that a full financing module would be too much, and but nevertheless, the financing is super important. So it was decided to integrate some critical elements of financing into the module number 2. All these, as I said, was done in consultations in country among the members of the facilitation team, plus results of the pre-course assessments that had been circulated to the different members of the Anticipation Technical Working Group of Myanmar. And we got around 18 organizations replies. The adjusting the materials based on the context was basically we took the existing protocols in country. For example, the heatwave protocol from the Myanmar Cross Society, or the World Vision Myanmar protocol on cyclones, and those examples were added into the modules. A very important and I want to highlight here a thing that element that is critical is the terms and acronyms need to be carefully revised and translated. So everything was revised and translated into the Myanmar language. I forgot to say that the full training was delivered in the Myanmar language too. And one clear example of why we need to carefully revise those things is because for the acronym of AA, for example, that is widely used among the humanitarian community to design anticipatory action, cannot be used in Myanmar because it coincides with the acronym of an ethnic armed organization. So using that here would create like unnecessary confusions. And the team on and on got a training package, training curriculum of 2 days, as I said, developed by Myanmar Cross Society, World Vision, and OCHA, with people that attended the Bangkok TOT.
Rafael, we might have to hurry a little bit on the last
yes.
information. Thanks.
Thanks, Damian. So after the training, we got the feedback from 27 participants, overall high level of satisfaction. Of course, also it's a very new concept and quite technical, especially the trigger, so perhaps need more time. Some people were saying that the conflict-related triggers were missing, and that there is a need for more examples, including successful and failed activations. But overall, it was quite positive. The training helped agencies to define better what they could provide and make them more confident in potential implementation of anticipation opportunities. Why do I say that? Because before the training, only 2 organizations were active, mostly MRCS, Myanmar Red Cross, and World Vision. And after the training, the new agencies have started their own projects led by the trained individuals like FAO. Others have secured funding, and others are looking for opportunities. After this first training, there was a request for a second training for the Gender in Humanitarian Action Working Group Myanmar. And there was a small addition of 2 additional presentations for integration of gender protection and inclusion and anticipation. And finally, I want to stress that UN agencies are recommending in Myanmar the establishment of an anticipation consortium for a joint approach, Red Cross UN, which was the case before the 2021 under the ECHO regional project. Next slide, please. And the last slide, recommendation for other regions. We have 6 recommendations. The first one, please use the national coordination structures. In Myanmar, it was the case, and it has been quite successful so far. The second recommendation, target the right trainers for dissemination. Most of the TOT participants, facilitators were practitioners at the country level, and this is super critical and important because they can bring real experiences to the table. Take stock of case studies across the region. This is the third recommendation. The TOT was also an opportunity to harvest good case studies from different countries. Then the fourth recommendation will be to, some of the modules might not fit the country's needs. For example, the social protection is perhaps more fitted for more advanced countries such as the Philippines. Then other modules that might be more basic might not fit for the most advanced on the other hand. And then it was also very critical as a fifth recommendation, the debriefing after the trainings, because then a lot of you can gather a lot of interesting information. As Damien mentioned, many of the countries actually added anticipation modules into their own CBDRM trainings. And there is discussion of potentially adding a training module in the anticipatory action package. And finally, you need to utilize the network of trainers for cross-country learning. This would be the last recommendation, and presentation is finished. I think we are going to discussion now, no, Damien? Thanks a lot.
I think so, yes. Thanks a lot, Rafael. So much
Sorry, I had to accelerate in the end.
No, it's perfect. I mean, Myanmar is one of the most interesting examples, I think, because after the training of trainer in Bangkok, you were able to bring the training to a newly formed technical working group on anticipatory action, and you raise a lot of interest. And now there are more and more agencies in Myanmar who are starting to prepare anticipatory action projects. So it shows the value of developing collectively a training package with proper contextualization that can really help reinforcing the interest among the agencies and perhaps in other countries, in other contexts than Myanmar, also getting government more involved. So yes, no, I think this is the end of the presentation. There are people who might go now, but if you have questions, if you would like to raise some points, get more information from Asia Pacific experience, please, this is the time. We are there. We can stay longer if there are specific questions to either Inyong, myself, and Rafael from Myanmar. Any burning questions? Sergio, please.
Hi, yeah, I'm Sergio. I'm from DG ECHO, and I'm the policy officer for anticipatory action. So thank you very much for this. Actually, I think we met here in Brussels when we did the FAO pragmatic partnership finished, and you commented about this, and I was very interested in know more about it. So thank you very much. It's very interesting that you are doing this. But yeah, I have a couple of questions. First of all, I mean, it's very good that you are doing an effort to do a training package that is combined with all the agencies, but actually, how did you deal with the different definitions and the different understandings of anticipatory action from the different organizations? Because I mean, they are what they are, and it's if it's FAO facilitating the training, probably the explanation will be different than if it's say IFRC or if it's whoever. So that's first. And second, and actually, well, this is a very small comment, but I only opened the presentation for the first module, and I saw that you used the G7 definition. So maybe now that the Grand Bargain caucus has finished, maybe it would be better if you use the Grand Bargain definition, because that has been agreed with a bigger group of agencies, even though it's still open for interpretation, but at least it's a more agreed definition. And then the last question, actually just yesterday, sorry, we had a presentation from UNDP on their preparedness learning pathway. Of course, it's much broader. It's about preparedness, but they have a specific module on anticipatory action, which I guess is much more basic than what we are doing. But I wanted to know if you have had any contacts with them, or if there's any coordination there, so that to make sure that also that we are not because this is also for governments, the UNDP one. So to make sure that we are not again confusing governments with UNDP saying something and then others saying something else. Thank you.
Thanks, Sergio, for the question. I'll maybe quickly respond to the last one on the coordination with UNDP. I must say, and maybe In-Yong will have a different point of view, that we have done our maximum to bring as many agencies as possible in the discussion. I think certain agencies might still be learning about anticipatory action, and UNDP at the regional level has not been extremely active yet. I think we need, and that has been a proposition we made to the technical working group on anticipatory action at the regional level, to maybe propose a crash course on anticipatory action for certain agencies who are starting to explore the work that could be done in anticipatory action. We were thinking of UNDP, we were thinking of UNDRR, especially because of the early warning for all initiative. And that's still something we need to push. At country level, sometimes we do have coordination with UNDP. I'm thinking of Laos, very much around flood risk management, where AA and preparedness can maybe be better connected. But yeah, we need to do more to reach to more agencies. When we developed the package, the usual suspects were there. In-Yong mentioned them: WFP, OCHA, Star Network, World Vision, CARE. Those are the usual suspects. In Asia Pacific, those agencies with FAO are covering 62% of the 137 AA systems that have been developed or are under development. So these 7 agencies, I think, are the usual suspects, the main actors, but we need to reach to more agencies, especially when they start developing perhaps their own training on anticipatory action. Very valid point. I don't know, In-Yong, you want to add anything on UNDP, or we go back to the first question?
I think you covered the question on the UNDP, and perhaps I can address the first question about how to sort of make consensus around the different definitions and different sort of approach. So I think what was useful for us is that we utilized or built on existing frameworks that are in the region. For instance, there's ASEAN framework on anticipatory action in disaster management that outlines the 3 building blocks of anticipatory action, the triggers, the actions, the financing. So we largely drew upon that, which went through already the consultative process while recognizing, it's ASEAN, but still, I think it's based on the consensus in the region and was sort of agreed with other sub-regions as well, largely. And then there's also, which I mentioned before, the Asia Pacific technical standards, where the technical working group developed together. This also went through a series of consultative process about different approaches and practices that are going on in the region. So this process that already happened before the training package really helped us to bring to the consensus about the definition or how the practices are framed as well. When it comes to like different expertise or mandates as well, we try to make it more comprehensive, like in module 2 or module 6, we try to add like different sectors. Obviously, from FAO side, we have lots of examples in agriculture sector, but we added also the health sector, the example of dengue, anticipatory action from World Vision, in sector like WASH from UNICEF, etc. So try to make it really more comprehensive, bringing in different examples were the efforts that we try to do as well. When it comes to facilitators, indeed, naturally they bring in their own experience of implementing anticipatory action. And that's why I think, as Raphael highlighted, the process of coordinating and having the right facilitator facilitating that module and agreeing on that really mattered. Whoever is facilitating, for instance, trigger module is really experienced in trigger and knows how to develop the trigger. In the Philippines, we had colleague Sandro, who's the lead of trigger subgroup of their national technical working group. So he was well positioned to cover that the topic and etc. So identifying the right person who can facilitate the module really makes a difference at the country level too. But perhaps I don't know, Raphael, you have also experience from Myanmar about having the facilitators.
Well, I would just say that all these points are needed. We need people that are experienced, and also I would say people that know how to communicate. This is also an extremely part of the success of our training here in Myanmar, is because we not only have practitioners, but also people that know how to communicate. This is crucial. That will be my addition.
And I guess there are still maybe some differences of conception that are there. We are really trying to have a minimum training package. So looking at certain common, I guess, agreed messages, but there might be a few differences here and there. I think in Young we had quite a big argument around in situation of conflict. That is still something extremely sensitive, and Raphael was luckily in the TOT able to share his own experience from Myanmar. But there are certain agencies who are willing to develop anticipatory action for conflict or in a situation of conflict. And we've tried to come up with some kind of agreed information that we could share in the package. But yeah, certain agencies may disagree. I see, David, you are raising your hand if you would like to come in.
Thank you so much. Thanks to the Asia Pacific team for having come up with this module. It must have been a challenging process. Of course, at a minimum level, the question that would come in, especially that we are looking at institutionalizing AA into the governmental systems. So the first question that would come in mind, to what extent that actually we did involve the government counterparties, or if there are plans in the future to maybe pre-test with the government people. If we borrow an experience from the Red Cross, when we try to come up with a curriculum, but we had a challenge of, first of all, the audience. So we have, in the Red Cross, we have, volunteer systems and so forth. So we ask ourselves, is this package for targeting volunteers? Is it targeting officers? So we faced that challenge and we did not go forward very much. And we actually credit to this approach that is the modules are broken down. In the Red Cross, we are trying to look at it from a level of a manual, just a manual. But I think I appreciate this approach that we have modular approach and in different sectors. So those are the issues. Then how then can we ensure that we involve centers of excellence like universities who are maybe specialized in curriculum? I think these are the issues, so that eventually we can institutionalize this approach to be accepted by governments. Otherwise, I think it's a great idea. And then also the other issue, how can we adopt it at the community level? So the issue now is the audience. Are we still going to have to break this further? Minimum, maybe targeting TOTs, people who will train others, or at community level, at the national level, at the subnational. I think this is the next step. And maybe you'll be advised to do some pre-testing with government counterparties, and maybe at various levels, subnational and maybe communities. Thank you.
Very, very valid point, David. I think some countries in Asia and the Pacific are also looking at how to train the training agencies in the respective countries. So I think in Vietnam, for instance, they worked very, very comprehensively on this module covering AA integration in CBDRM with two very experienced trainers from the government. So they work with the government on this particular module, and then systematically after those trainers from the government were delivering that particular module on the integration of AA in CBDRM. And there are a few other examples, I think, in the region. In Indonesia, they did also training of trainers for the government, and then the government was eventually replicating the training at the subnational level. Maybe you have some other ideas, Inyong.
Also in Timor-Leste, they did a 5-day training of trainers to subnational actors, as you highlighted, David. It's also something that was considered very important in Timor-Leste context as well, and was delivered to civil society organizations as well as some subnational government stakeholders. So then it can be replicated to that level, but it needed that contextualization process. So when we launch the training package, obviously it's a minimum package, as Damien highlighted. So it needs to be tailored to that audience. The content may need to be adjusted if it's for subnational level, if it's for community level. So certain modules, such as the trigger development, it might not be necessary for certain actors. So those need process, the contextualization and tailoring to audience really needs to come in play.
And on the opposite, Inyong, I think there were some countries who quickly decided that the training would be focusing on the humanitarian partners, not the government. I think it's why you really need to agree on which audience you want to target. And then, yes, you contextualize your training package for that audience. So either you go to train government or you train humanitarian actors, like in Myanmar, who might be interested to develop their own anticipatory action system. That's a choice you have to make very, very early. Step one, I think, Rafael, when you contextualize the training package, it's the first step, which audience and like which module you will be using.
Exactly, Damien. Just a small comment in the Myanmar case, it was agreed since the beginning already that it would be that the audience would be focused in humanitarian community due to the context that is quite sensitive right now.
I noticed, Tim, that there are quite a lot of exchanges in the chat box of the community conversation. Is there like any particular point that we should perhaps discuss? Because I just saw that there were a lot of exchanges. I haven't had the time to read them. Anything we might have missed, or?
Well, one little section of conversation was about the use of acronyms. I think from Raphael's presentation about Myanmar, about how the acronym AA can be confusing in certain contexts, and just generally about how we use language in the communications. I don't think there are any questions that we've missed. I think they've all been questioned. There was one about how to implement the training in Japan. So I guess maybe perhaps if we could ask you if a country watching this, whether today or later when we share the recording, sees this and thinks, right, I want to do this in my country, what's the best approach? Just to go to the resources and use the guide for facilitators, or is there support available from the technical working group in Asia Pacific for people that need a bit more support? What's your level of input from this point on?
That's interesting. Yeah, definitely the first step would be to look at the material and the facilitator's guide. I think in Young we have also included the list of the first trainees who are now trainers, who have already replicated the training. So if there is like any interest in a certain country to reach to a particular trainee from, I don't know, Sri Lanka or from Myanmar, I mean, now we have also, I think, this list of trainees coming from different countries. I know that our colleague from FAO Sri Lanka has been invited in Bhutan by ADPC to support the training in Bhutan. And he's going next week to India to attend also a workshop on anticipatory action. So we have a number of trainers from different countries in Asia and the Pacific who can be contacted. I think we have put their contact right in the Anticipation Hub webpage. Yeah. So from 13 countries, including Thailand. So already quite a number of different backgrounds and different experience can be helping, sharing feedback and making recommendations. So you don't necessarily need to go to the regional training of regional technical working group training subgroup. You can directly contact maybe some of the trainers in Sri Lanka. Maybe in future we will have more trainings in the region and more, experienced trainers who can be contacted. So maybe just a quick information from the 12 initial countries. We have now an additional 3 countries who start to implement anticipatory action, namely Fiji, I think, Afghanistan, and I'm missing one. So we hope to have also trainings for these new countries. Bhutan is also coming in. Maldives. But Saju was in Bhutan 3 weeks ago, if I'm not mistaken. Saju, you want to jump in?
Yeah. Thank you, Damien. Actually, I am traveling last 6 hours. That's why actually I'm not sharing any points. But can you hear me now? Still, I'm traveling. I'm in the car.
We can hear you, and we can hear a little bit of the background, but don't worry, you are very, very clear.
Yeah. Actually, I'm traveling in our coastal area. So next 2 days, we are going to organize training on anticipatory action for CPP volunteer. Only some update from our end. Already in Raphael's side, it was shown that Bangladesh also done training on that is after the tour training. So 2 training done by FAO, 1 training also done by the Red Cross Crescent Movement, and also we have another plan, organize another passports number. Already we scheduled and keep a date that is on 18 and 19 December. And we have also National Early Action Protocol on cyclone and flood, and we organize a joint simulation on National Early Action Protocol on cyclone coming 2nd December. So all Al-Wani for all initiative stakeholders, they are also involving for that simulation. Regarding the module, yeah, diminished, though we are discussing some forecast elements or risks analysis.
Saju, you are breaking a little. So I think you have mentioned that Bangladesh has already replicated the training a few times, and indeed Bangladesh has a lot of experience in delivering training on anticipatory action. But you are one of those trainers that can be contacted to get more information on how you adapted the training package for Bangladesh context. Definitely you are one of those resource person that anyone can contact. And you were in Bhutan with our colleague from FAO very recently.
And also just last, before Bhutan, I was also in Sri Lanka for facilitating the training for the Sri Lankan government with FAO colleagues. That training also organized by ADPC.
Excellent. I see another hand, Saju, if it's okay with you, we'll move to Christian.
Yeah.
Thanks, Saju.
Yeah.
Christian, over to you.
Yes, hi everyone, hi Damien. Thank you very much for this very interesting session. I'm with the World Food Program in Abuja in Nigeria, and the whole concept of anticipatory action has been around here for not so very long. Actually, here at WFP, we're just now getting started to conceptualize our strategy. And I think it would, of course, make very much sense to back this up with some kind of training going forward. I can also point out that the national emergency management authorities are also keen to develop their anticipatory action framework. And of course, Nigeria being a federal system, every state has their own approach, but the few state-level emergency agencies we've spoken to, they also have expressed an interest. So my question is, how can we best go about to initiate these trainings, also building on the experience in the Asia-Pacific region? What steps should we take to bring some kind of training modules to Nigeria? Would it make sense to do this through OCHA, given that they are heading, of course, the Anticipatory Action Task Force, or just what do you recommend going forward? Thank you very much.
Maybe Rafael, I think it could be interesting to re-highlight a little bit how you did it, because OCHA was coordinating the Anticipatory Action Task Force in Myanmar with only a few actors already active. So I think it was making a lot of sense in the context of Myanmar to go through OCHA to coordinate the development of a contextualized training package. That worked pretty well. Maybe if you want to share.
Yes, Damien, actually, we had the Emergency Response Preparedness Technical Working Group in Myanmar that has been operating for a number of years. This is co-led by OCHA Myanmar and Myanmar Red Cross. And around 2022, we already started conversations about, we are interested in anticipation. And therefore, the members of the ERPWG took the initiative under the umbrella of OCHA to establish in 2023 the Anticipation Technical Working Group. And it has been through that Anticipation TWG that everything has been led. We have 3 organizations that attended actually the DOD in Bangkok that sent 1 representative. And it's OCHA, World Vision, and Myanmar Red Cross. And these organizations have been the ones that have been responsible for contextualization of the package in all the communication with the different agencies of the technical working group, gathering the information on their needs, on their level of knowledge and anticipation, their level of interest, etc. So I would say in our case, it has been quite straightforward and perhaps a bit easier than in other contexts because we don't have that many, let's say, organizations. We didn't have that many organizations that were doing anticipation in the country. When we started, it was Myanmar Red Cross and World Vision. And then OCHA came in to kind of coordinate, but it was these two agencies. So it was clear since the beginning that they would be leading technically in the whole process, plus OCHA coming in and bringing everybody together and connecting those to the technical working group members. But it was in this way how we kind of started the whole process. In countries like Nigeria, I can imagine it would be a bit more complicated in terms of the coordination, right? Damian, maybe you know more about this.
I'm not very familiar with Nigeria context, but I believe we need to coordinate between agencies the development of the training. We saw the value in Asia and the Pacific of combining forces. I think in pretty much the 10 countries that already use the training package, we have maximized the collaboration between agencies, and that is probably the most successful way of doing this capacity building process. So yeah, I would assume working with OCHA in Nigeria would be a logic first step. Maybe looking at who are the key actors who can help you. So WFP, perhaps Red Crescent movement, and OCHA. You can be a small group at the beginning, but immediately after the first training, maybe similarly to Myanmar, you will get a lot of other agencies who can help you, replicating the training in more areas. So you can start small. I think in Young, we started with 6 agencies at the beginning, the development of the training package. We had quite a successful training of trainers with more agencies. And as Sergio mentioned, we still need to reach for new actors. But we're getting there. So yeah, OCHA probably would be a good starting point. But again, I don't know Nigeria context very well. Yeah, the experience of Myanmar can be useful perhaps in other countries. Yeah, Christian, sorry.
No, just to say that helps a lot, Damien and Raphael. Thank you for your feedback on this. And indeed, I think going through OCHA and including of course FAO and WFP and perhaps some NGOs who have done some anticipatory action like the IRC, that would be the right approach. But having a training here also for the government counterparts, I think is the good way to start. Thank you.
Welcome. Any last comments, reaction? But again, everything is available on the Anticipation Hub webpage for Asia and the Pacific. There are contacts also in the webpage. So happy to receive emails and answer your questions through emails. Benjamin, sorry.
Thank you so much, Damien, and greetings to everyone. So I'd just like to share my a little bit of experience that I've had, as in the sense to say, one of the things that when you look at the work that is especially on anticipatory action and even the training modules themselves and all that, it's quite cross-disciplinary. So at the end of the day, especially when you're trying to work with government stakeholders at times, it may also be a bit helpful to kind of like take them separately, as in when you are discussing about triggers, because at times some of the capacity will exist, but at times there are certain gaps. But from there, you can actually have those kind of like discussions separately, where you kind of like everyone understands their role in the whole process. Then after that, it will then be easier to then bring them together and then do more like a training that would then cover like quite a number of areas. Because, for example, when you're going to be having a discussion about triggers, definitely you will have like your hydromet agencies be the ones that will be very familiar with that. Then but you'd also have other people or other government stakeholders or other even stakeholders who are not necessarily very technical in that area. So you tend to kind of like lose them in that discussion. But then when you get to areas where they are also very familiar, you also get to lose the other technical people because they may not necessarily be their strengths. So how I've actually seen it and how we have actually done it in Zimbabwe at when I was actually there is to kind of like take this fragmented approach to break it down into those areas, then finally bring together everyone, but with everyone having an understanding of their whole role in the whole context. And the other thing is, because people are very familiar with the disaster response and the preparedness phases of the DRIM cycle, I usually prefer taking the approach of going back to the DRIM cycle, pointing out where anticipatory actions fit, and then you start explaining, you start elaborating more. So the more you actually bring light in that area, you also deal with certain misconceptions that also come in, and you also deal with certain things. Because one thing that you definitely come across even when you do this training is you will always have people who refer to certain things that would fit within the response phase of the DRM cycle, bringing it also to anticipatory action and certain observations, certain indicators that won't necessarily fit within the anticipatory action window will be brought there because people are very familiar with that. But when you kind of like explain and when you kind of bring it out, then it clarifies those things and it also makes your life easier. So once everyone understands their role and their responsibility, it will be easy even in terms of institutionalization, because every institution will come knowing their mandate and they will then put in their mandate into the whole anticipatory action framework, and it will be easy to get their buy-in. Thank you.
I think we agree with you on the training package that can be delivered to a community of practice doesn't prevent certain agencies to have a one-on-one training. I mean, FAO, we do work a lot with Ministry of Agriculture. We have also sometimes this particular dialogue and particular orientation that we do on anticipatory action for one particular or two specific agencies. So what we think is that if we can agree on the messages between different agencies at an early stage, that maybe simplify and avoid confusion when each of the agency interact with, let's say, the Met Office or interact with Ministry of Finance or interact with the Ministry of Agriculture. So what we had really started to think at the beginning, I think it was one of the slides of Inyong, was like, how do we have a consistent message across agencies with different objectives and different understanding sometimes. So we came up with the minimum training package, and we were thinking, let's use that package for the community of practice quite early, so that after, if they interact with different government partners, hopefully they convey the same message. So, working like on a one-on-one or bilaterally training is perfectly fine, as long as the different agencies, agree on the common, same elements. So that's why we had that idea of building a minimum training package. I don't know, Inyong, Raphael, if you want to add anything.
Not much to add from my side. What about you, Raphael?
Same, not much to add. Thanks a lot for the discussion and the comments. It's very interesting.
Very, very lively indeed. and we do hope we will hear from some other regions in future on how they do maybe development of minimum training package, if that happens. But yeah, we are a strong advocate. Do we say like this? We strongly advocate for working across agencies and to work together. It's super important that we are able to work on AA at scale, so with common practices. Back to you, Tim.
Yeah, thank you very much, Inyong, Damien, and Raphael for sharing your experiences with us today.